So, Ruth, over to you.
Hi, everybody. Can you hear me okay?
Yeah.
It's lovely to be here. Thank you very much. So my name is Ruth Keeler. My job title is that I am the Strategic Lead for Careers and Engagement across Lancashire and South Cumbria ICS. And this is a role that I've had. It's been running for the last 2.5 years. But for 5.5 years, we've been delivering careers and engagement activity across Lancashire and South Cumbria, and reaching up actually to cover a lot of Cumbria as part of the footprint, because North Cumbria does not have any careers and engagement team. But a little bit just about the context in terms of our geography. For those of you who aren't sure about Lancashire and South Cumbria, it's an absolutely stunning place. But we sit just on the M6 corridor, which makes GM and also Cheshire and Mersey really close for us. So we really struggle with some of our recruitment. And some of our other concerns would be that I'm based in Lancaster, and if I travel less than 10 miles, 5 miles down the road, I can decrease my life expectancy by 10 years. So we do have significant areas of deprivation across Lancashire and South Cumbria. So whilst it's absolutely stunning, it's also a really challenging area to work in and to try and improve the healthcare that we deliver, and also the recruitment that we undoubtedly need, because as like many of you on the session today, we really struggle with different areas of our recruitment. And as Jackie mentioned earlier, we really struggle with the whole robbing Peter to pay Paul. I know there've been lots of comments on the Slido about social care, and it's one of the things that we've been looking at across our system, is how we work system wide, how we really do think about social care as part of the health and care offer that we have, and how we work together in partnership with our colleges, with our LEP, with our universities that we've got locally, etc. as well, and really think about how we can join the dots really. So the careers and engagement work over the last 5.5 years or so has basically, under the umbrella of widening participation, running employability programs, supported internships, step into work programs, lots of different types of placements, work experience, all of those kinds of things that Preeti mentioned earlier also. And we've been delivering those system-wide, but in silos. And for the last 2.5 years, I've been coordinating that work and trying to make sure that we create more equity across the system, and we reduce the inequalities and the gaps that we have. So this time last year, obviously, we were just in the throes of the beginnings of the pandemic. And by August, we had over 15,000 people across Lancashire alone who'd been made redundant, which was really significant. And that number only increased throughout the autumn. So it became clear to us that we needed to offer and to do something different with the numbers rising, and obviously the health inequalities that would lead to, etc. And as people spend longer times having been furloughed or having been made redundant, they get further away from the labour market, as we know. So in the middle of November, we were told locally that we needed to, that we needed to open and deliver mass vaccination recruitment. So obviously this was a concern, and we knew that that meant that we had a number of vacancies we would need to recruit to at pace, really. And we were really quite well placed locally to do that across Lancashire and South Cumbria, because we were able to use the volunteer pipelines to support the mass vaccination centres with marshals. And we also, because of the commitment towards employability and recruiting from our local communities we already had, we knew that we could use our redundancy pipeline to kind of kickstart and to recruit to the admin and clerical roles. Now, I make that sound really easy, and in some respects, it was quite easy, because for the last probably 3.5 years, we've been working in partnership. So we have had a very long journey of building relationships and understanding priorities across our different providers. We have had a shared vision of how we can support people within our community so that they don't fall through the cracks and get further away from the labour market. And as I said, for the last 3.5 years, we've been working with the LEP. We've been working with the NHS in terms of acute, primary care, social care, our education providers locally, and our DWP and Job Centre Plus colleagues as part of a health and social care skills partnership group. So it seemed that we already had made the connections, we'd done the groundwork, and it was quite easy then to pull together a new programme to recruit for the admin and clerical roles. So what did we do? How do we get started? Okay, so first thing to say is that this wasn't a mandated decision, but neither was it a huge visionary decision that somebody dreamt up. It was a natural progression from work that we'd done already. And that is to create a flexible and opportunistic pipeline which worked for everyone. So it would work for our providers, our education providers, who were able to co-design with us a short 2-week programme. It was easy for us then to join the dots with that and to move toward basically working with the job centres. They would send through those people who had been recently made unemployed, and we were able to do that really through our redundancy task force. So I suppose the order of things was that we were first of all asked to deliver mass fax recruitment for the mass fax centres. We knew that it would be very easy to specifically target those people who'd been made redundant or long-term furloughed. They would have the skills we would need for the admin and clerical roles, and as I said, the volunteers and that pipeline for the marshals. And really what we did was we decided to choose 2 of our providers to be kind of the centre of this pipeline. And the job centres funneled through and signposted those people that I've said who'd been recently made redundant and long-term furloughed. They signposted those people to a specific email address. From there, we had programs running, so specifically focusing on information governance or IT skills, communication skills, customer service, those kind of things, which we knew we would need as part of the vaccination programs. And then what we did was people who particularly wanted to apply for the roles, we made sure that we had changed the person specification so that we didn't include lots of big qualifications and you need a degree and you need this, that and whatever. We actually just focused on skills and made sure that they had a reasonable standard of English and maths, so no formal application forms. And what that did was reduced all the bureaucracy that people usually have to navigate in order to be employed in the NHS or to work across health and care, and really speed things up. But it also broke down lots of barriers. It broke down barriers for our education providers and also helped to build a relationship for us, because we were able to just say, this is what we really need. We need people who can speak to their own communities, who can be welcoming, who can understand spreadsheets, etc., for whichever one of the jobs it was or the roles it was, and actually who are going to be really engaged in this. So lots of people were going to benefit. When let's call them learners, so when the learners went on program, they were then filtered. So those people who weren't really job ready and would be able to hit the ground running, they were filtered into a longer program, a longer employability program with us. And those people who were absolutely going to be able to hit the ground running and who were job ready were filtered through to be able to apply for a role with us in the mass vaccination centres. We created a really quick portal to be able to host the interviews. Applicants booked slots, and then we held a normal interview, but we tried to keep it quite informal. Actually, we knew we needed people who had the right values, and the rest we could work with because we already knew they had the baseline skills, if you will. Cohort 1, we decided on a threshold of in terms of marking criteria to make it really easy, and the applicants found out within a few days whether they were successful. And cohort 2, because we learned and we'd done some PDSAs and learned from cohort 1, we were able to actually decide on the day and give the applicants the successful news and the congratulations there and then, pretty much. What else? Let me just think, what else did I want to do? Yeah, so this was really about joining the dots with work we'd already done. And in terms of why it mattered, so there were lots of reasons why it mattered. The main reason was obviously the people in our communities. So this was going to benefit people from a holistic perspective, build confidence, raise aspirations, but also it showcases opportunities for us across health and care, gets people thinking about working within health and care with the NHS and the mass facs centres, which was obviously pre-Christmas. Everybody was talking about it and still are on a daily basis, and get them, to start engaging with the community in a different way, but also thinking about opportunities with us, which maybe they didn't think of before when they were working in different sectors. There's an obvious economic benefit to that. There was a huge benefit to us in terms of being able to staff the mass fac centres, but also to be able to help our communities in terms of the economic benefit. And then partnership wide, what it did was stop that whole revolving door of people jumping onto programs and, just being able to pull down funding for partners and then move them on to the next bit of the carousel. Actually, this was a really good way for our education providers to work with us in partnership rather than all of us working in silo across the employability agenda. And have a really collaborative, committed approach to what we are going to do in terms of serving our communities and becoming an anchor for employability opportunities. So it really strengthened our partnership working and the ability to do something meaningful. We all felt that we'd done something really special by kick-starting this pipeline, which of course is only a pilot. As you can see, outcome-wise, we had 141 recruited to the programme and interviewed, and of those, we give contracts to 121 of the learners. So those who were not successful, we refunneled those through. They then were able to participate in further programmes with us in order to get them closer to the job market. But then obviously what it has done is to showcase the benefits and the strength in working in partnership. So we have really cemented our relationships with our partners. And it's also been able to make sure that when we are talking about system-wide opportunities, we are thinking system-wide. So when we're talking with the county council and they come to our social care skills partnership group, we're talking to all of our colleges, they're there, and we're trying to understand how we can work more successfully in order to get better outcomes for our communities. And then the final thing in terms of outcomes is we showed that we don't need all of the bureaucracy. We don't need lots of red tape. We can be really flexible. And I think that's really critical in terms of how we take employability programs forward. Next steps wise, it's as you can see on that slide, it's working with partners to explore new ways of how we work together to benefit our communities and each other, because at the end of the day, a lot of our partners are businesses. And also it's looking at other opportunities such as Kickstart, working with our NEETs, creating opportunities for carers, etc., across the range of careers opportunities that we have, and how we can just be a bit more aligned in our approach rather than, competing with one another. And that's it from me. Thank you, Gweno, for holding this slide.
No problem, Ruth. That was great. Thank you very much.